Hello, everyone. Welcome back. I am Christine Dixon of the Ordinary Sacred, and I'm continuing to read some sample IFS sessions from the Internal Family Systems Skills Training Manual by Frank Anderson, Martha Sweezy, and Richard Schwartz. And in this one, it's really about asking an exile not to overwhelm the system, because this is one of the biggest concerns of protectors. They are pushing the exile down because they do not believe that the person can handle the big emotions and painful beliefs of the exile. And so there can be this negotiation with the exile to agree not to overwhelm the system. And once they have agreed to that, then we can tell the protector they've agreed to that. Is it okay if we go forward? Because you always want to get the permission of the protector, right? And meet their concerns. And if they do start to overwhelm the system, you can rush back in, right? So this is an example of that. And the therapist says, it seems like you have an anxious part who keeps jumping in. Do you notice that? This is so funny. I feel so curious about who this is, if it's Frank or Martha or Richard, because like in the last video, I talked about them saying, you have an overreactive part, and one of my parts was responding and saying, oh, that feels shaming. I wouldn't want to be labeled and called overreactive. Um, and it's funny, I have anxious parts who are not as great of a degree, but are kind of like, I don't want to be called anxious. I don't know what else you would say though. Um, that are worried. You have some parts that are worried. Anyway, the therapist is reflecting back what they see, right? It seems like there's an anxious part that's coming in. Are you aware of that? Do you notice that? And the client's name is Pete, and he says, yes, it's having a hard time staying back. It won't stay in the waiting room where we put it. Okay, so a lot of times when you do have fearful parts, sometimes we'll ask them if they can go to another room, a waiting room, a playroom, a room with a caretaking part to take care of them. They're usually very young. And because whatever we don't fear in our system cannot hurt us. This is a law of inner physics. And so when the fearful parts are there, it kind of blocks the way of the self energy going toward big, scary parts. So it sounds like they put the anxious, fearful parts in a room and they keep coming back out. Okay. And so the therapist says, ask what it's upset about. Yeah, so you always want to understand, they're always coming out for a reason. So you want to meet their concern or they'll just keep coming out. Pete says, it's afraid that I'm being taken over. That's a very typical fear. The therapist says, would it say more about that? Pete says, it's afraid that I'll be taken over by the feelings of the part who was criticized by my football coach. It says, we're messing with something that I cannot handle. This is so common. So I just want to say a note about this. I've experienced this many times in my own system, in other systems as well. When we do go to something that is really fragile, volatile, sensitive in our system, a moment that feels, obviously back in that time, we didn't have the resources to handle it. It felt really overwhelming, right? So our protective system is trying to get that to not come up at all costs. So it makes sense that they do not believe you're resourced enough to handle it. They do not want it to come up. So sometimes if we steamroll over them and we try to go to a trauma moment before the system even understands that there is a self inside or trusts that it can go, if we try to go ahead of time, they will backlash. They'll throw us into total hypoarousal, right? Just shut us down, dissociation, sometimes huge inner critics, suicidality. It can be really, or addictive parts, escaping. So we really, really want to gain their trust before we go to anything that is traumatic. Okay, and then the therapist asks the question, how old does this part think you are? Which is a really good question because it likely thinks you're young, or the age when that happened. How old was he? Does it say when the football coach? No, I don't know. So how old do you think you are? How old does it think you are? It says, then don't filter the answer, just say whatever comes up. And Pete says, it thinks that I'm 17 years old. That's when I played football. Yeah. So again, back at that time, Pete was not resourced enough to handle this and felt very overwhelmed. And that's why these protectors came online, right? So the therapist says, let's give a chance to get to know, give this part a chance to get to know the Pete of today, the Pete who is not a part. Ask it to look you in the eye and let you know who it sees. Again, this is another thing you can do to see if you're blended with another part. But it sounds like, oh, and they make a note here, giving credit to Mike Elkin. Mike Elkin is a lead IFS trainer who's really great. And this was one of his contributions to IFS, was asking a part, who do you see when you look at me? And that's something that's been really valuable in my work in my own system and with clients. Pete says, wow, it's really shocked. It had no idea that I'm grown up now. And the therapist says, how does it respond to you? Pete says, it sees me, but it still thinks the feelings are too intense for me. Yeah, it just doesn't have experience with the self yet. Okay. Okay, so now the therapist is going to choose to do direct access. So direct access is just when the therapist self is now going to talk directly to the protective part, because the protective part is not seeming to know how to trust Pete's self yet. So the therapist says, can I talk directly to the part who felt criticized by the coach? And I will ask it not to overwhelm. Okay, so the therapist is going to talk directly to the exile. This is interesting. The note says the therapist offers to address the protector's concern, which is the exile overwhelm, by speaking directly to the exile. Sometimes our protective parts will trust the self of the therapist because they've experienced that, and they will let the self of the therapist talk to the exile. And it says, alternatively, the therapist could have stayed with introducing the part to Pete's self and having Pete ask the exile not to overwhelm. Either way is fine, but direct access is often faster. Yeah, again, I want to reiterate this. There's no, one's not superior to the other. I mean, essentially, you do want to, as a practitioner, pass the baton back to the person self because they are their own primary caregiver and, have access to their own self 24/7. But sometimes when you're in, this limited amount of time in a therapy session, doing direct access can be a little bit quicker to get to the point where you can pass the baton back. So Pete says that would be great. So got permission for direct access. The therapist says, so I want to talk directly to the part who was criticized by the football coach. Are you there? Pete says, yes. This is the exile. And the therapist says, I hear you have some strong feelings. Is that correct? Pete says, yes. And the therapist says, we can help you. If you don't take Pete over, you'll be able to show him what happened. And then we will be able to help you unload this pain for good. Okay, so this is interesting. So the therapist, I understand now why this is can be very helpful. The part of the therapy that the therapist is doing direct access with is convincing the exile to not overwhelm the system. The reason why direct access is so helpful here is because I call this the chicken or the egg, right? Where you're trying to convince the protective parts to let the self come out. But the issue is they won't let the self come out because they're afraid of the exile overwhelming. But they need to allow the self to come to negotiate with the exile to not overwhelm so that the protectors can trust enough. But they won't let the self out, right? So there becomes this dilemma. So a really valuable role that the therapist or coach can play is let me negotiate with the exile and let them know and assure them we're not trying to get rid of you like the protective parts have tried to do. We really want to hear from you, but we need you to agree to not overwhelm the system so that the one who can be with you and listen to you and get you, the protectors will let that one come, right? So the self of the therapist is acting as this mediator in that way, and it's really, it can be really helpful. Okay, so the therapist has explained that we can help and help unload the pain for good. And Pete says, this is the exile saying, how? And the therapist says, if you stop overwhelming Pete, the worried part will be able to relax, and then Pete can help you, the Pete who's not a part. Do you want to try that? And Pete says, yes, I'd like to, but I'm not sure that I can. The note says exiles are capable of separating, but are not in the habit of doing so voluntarily because they associate separation with being exiled. Right. So the therapist says, that's fine, let's practice. So again, the exile is capable of not overwhelming, of sometimes we'll say titrating their energy. I don't know if they're going to use the dial here or not. I'm not sure. Oh, they're doing a different technique. But there is a technique where you basically hand the exile this kind of volume dial. And it's not controlled by the protectors. It's controlled by the exile. And the exile can turn up their energy or turn down their energy. So one alternative would be that the therapist self would practice this with the exile. Okay, turn it up. Okay, and now turn it to a, say it's 1 to 10. Turn it to an 8, turn it to a 2, turn it to a 5, right? So it can, in this way, the exile is getting evidence that they are capable of controlling the volume of their energy. And the protectors are also getting experience seeing, yeah, that the exile is able to do that. It looks like they're not using that technique though. It says, the therapist says, let's practice. And Pete says, okay. The therapist says, let's start with you sharing just a little of your feelings, say 10% or a couple of drops. So it's very similar, right? But instead of the dial, they're saying percentage or a few drops. Okay, now how does it feel if you share 50%, right? And just practicing that. Okay, so the therapist says, are you ready? And Pete says, yes. The therapist says, great, let me check in with Pete first. Pete, did you hear that? So the therapist is now inviting Pete's self into the conversation. Pete says, yes. And the therapist says, did the worried part also hear this? Pete says, yes. And the therapist says, are you both ready for this part to share 10% of their feelings? Again, asking permission even for the 10%. And Pete says, yes. And the therapist says, okay, Pete and the worried part are both ready for you to share 10% of your feeling with him. So go ahead and let me know when you're feeling it, Pete. And Pete says, I'm feeling it. And the therapist says, is this level of feeling okay? Pete says, yes. And it's really asking the anxious part if it's okay, because it certainly is okay with the self. But it seems like it's okay for the anxious part. So the therapist says, let the part know that it is okay so far. What is it like for the part to share 10% with you? Pete says, it's a little bit of a relief. Yeah, I mean, this is such a beautiful example because the therapist self is working, it really is like being a mediator and having a bunch of people, right? You've got Pete's self. Okay, so it's like this. Here's the exile over here. Here's Pete's self over here. The worrying, anxious part is blocking the way. The way to healing is for Pete's self to connect with the exile, right? But the worried part is blocking the way. And so the therapist self comes over here and negotiates with the worrier to say, will you let me go to the exile so that I can negotiate with them about how much they show you and not to overwhelm, because that's the concern. So they go over here to the exile. So there's 4 parts, right? There's the self, the anxious, or Pete's self, the anxious part, the therapist self, the exile. Right? So now the therapist self is negotiating with the exile and say, we're going to practice, and then turns around and says, are you all aware? Yes. Is this okay? Yes. Exile shares 10% of their energy. How is that? Good. How is it for you? Great. I feel relieved. And now they're all getting evidence that it's going to be okay, that the exile can titrate their energy, especially if they know they're going to be met with compassionate witness. So now, okay, there's the self, here's the anxious part, gets this evidence and now will be more willing to soften and let Pete's self come in to meet the exile, knowing that the exile can titrate their energy if needed, right? So just a beautiful example of negotiating there. All right, there's just a little bit more. The therapist says, great, is it okay to keep going? Let him know what percentage of the feeling he can share with you now. We can go very slowly. And let me know when you're ready to stop and talk about what it's like for you to be together. So the therapist has effectively facilitated the togetherness of Pete's self and his exile. As this example illustrates, we get permission to talk to the exile so that we can ask it to stop overwhelming in return for getting some help. The therapist self also helps the client system feel safe enough to experiment. Yes. And this is often, honestly, the role of an IFS therapist, coach, practitioner, is offering enough of their own self to eventually negotiate, experiment, and facilitate the client self meeting with all the parts, the worried part and the exile and any other parts in the system. All right. So if you have any questions about that or any comments, please feel free to leave them in the comments below.